Dear all, this is Health4EUkids lesson number 1, Smart Family General Overview. This is Heli Kuusipalo speaking, and our content today is how Smart Family has been transferred into Health4EUkids. First, you can take a brief look at the map where we present all the participating countries. Before this, I just want to introduce that in the Smart Family work package lead, we are 4 persons from THL, me, Päivi Mäki, Nella Savolainen, and Emma Koivurinta. And the practice owner is for Smart Families, the Finnish Heart Association, which is presented by Kati Kuisma and Taina Sainio. Here in detail, what kind of scopes have the member states selected into the introduction and implementation of the best practices. It depends a lot which each member state has decided to take into focus, and Croatia's focus is in kindergartens, children 4 to 7 years old. Greece has in focus pregnant women who are in the 3rd trimester, and also training of health professionals. Kaunas city in Lithuania has decided to take the focus to 7 to 11-year-old children. In Poland, there are many primary school students who are in the focus from 6 to 12-year-old. Slovenia has chosen families with children aged 0 to 12 years with a special focus on the first 1000 days. In Spain, the Balearic Island is participating into our best practice with the children who are overweight, or mothers with overweight, and the children who are in these families have the age of 12 to 14 years. This is just a brief timeline of our milestones, and as you can see, we were starting the best practice piloting in 2022, and we will have the final conference on 25 in November.
Hello, my name is Nella Savolainen, and I work as a senior specialist in Finnish Institute for Health and Welfare. I'm here to talk to you about the implementation strategy of Smart Family. So, the Quotas Plus joint action worked through 2017 to 2020. It worked with transferring and implementing good practices in Europe. In Quotas Plus, a common implementation strategy was developed and used. In Quotas, they transferred good practices around health promotion and disease prevention, and succeeded in transferring and partly implementing the practices, using the implementation strategy, and organizing the continuous support from the good practice owners to the implementers. In the beginning of 2023, we decided in Health4EUkids to use the experiences from the previous joint action in transferring best practices among countries in Europe. The lessons learned from Quotas were that it was important to create environments and communities that support health. It was important to build on existing motivation and resources, and to apply a clear implementation framework, and to invest in strong links between project owners and implementers in all phases of the intervention, and make the process of transferring and implementing good practice fun, and invest in creating communities of good practice and change. So these lessons in mind, we started the work. So we also started to plan the implementation strategy with 3 phases. We developed the implementation strategy, each with designated tasks for the implementers and the leaders of the work package. We also planned the support for the implementers along the way. The support was continuous support from the Smart Family Practice owners from Finland, from the Finnish Heart Association to the implementers. For example, monthly meetings with scientific background and country visit in Finland. And in this slide, you can see the implementation strategy of Smart Family Best Practice. So during the pre-implementation phase, the piloting countries analyzed the country-specific baseline situations with strengths, weaknesses, opportunities and threats and scopes, and formulated pilot action plans. The work package leaders offered information on the Smart Family practice and experience in Finland, the scientific background of effective lifestyle counseling, templates for implementation plans, training, and also they trained the trainers of Smart Family method and offered an e-learning platform for training. During the implementation phase, the pilot actions with the support of the local implementation groups were taken. And of course, the piloting countries collected data. The work package leaders offered support for the choosing and using the methods and materials of Smart Family and organized regular mentoring meetings and supported the local trainings for chosen settings and co-developed the assessment framework. During the post-implementation phase, the piloting countries are documenting the results of the pilot actions and evaluating the successes and failures and organizing policy dialogues to ensure sustainability. And the work package leaders are leading the documenting, offering templates, and supporting and attending the policy dialogue meetings. In this slide, you can see the pilot action plan template for pre-implementation phase. It was important to think in each country, what are they trying to accomplish? What are the goals of the work? What changes are they going to make? And how will they know that the change is an improvement? So in this template, there are specific actions and also measures that they're going to take during the implementation phase. In this slide, you can see the example of an implementation plan that we offered to the countries to help them to formulate their own implementation plans. And also we commented on the action plans of the countries when they were finished. And during the implementation phase, all 6 participating countries started the work. They started to implement their plans with different professionals. And continuous support was offered. The post-implementation phase is ongoing currently in the spring of 2025. The reporting is underway. The scientific articles, one is under work and one is planned with the results. And the policy dialogues are currently being organized in the piloting countries. And we are supporting countries to define clearly the objectives for the dialogues and think about who to invite, for example. And this policy dialogue methodology is also from the Cordis Plus joint action. They, in Crotus Plus, published the Guide for National Policy Dialogues and learnings from the Crotus Policy Dialogues as well. So policy dialogues are more than just discussions on a specific policy issue. Policy dialogue can be the start of a longer policy process or be embedded into an ongoing one. So this single dialogue, of course, we understood, will not trigger change instantly, but it can be a start of something. And it's a nice wrap up of all of the work that it's been done in the countries as well. We offered an example of the schedule, how could it go in each country, and offered also, of course, a speech from Finland, an experience from Smart Family implementation journey in Finland. And in this slide, you can see the policy dialogue action plan that is then made after the policy dialogue or during the policy dialogue. Depends on each country how they want to fill in the policy dialogue action plan. So this was all from my side. Thank you all for your participations.